Welcome to Mental Health MD. I'm Dr. J, a psychiatrist, and I make mental health easy to understand and useful for real life. Let me tell you about a common story I hear as a psychiatrist. A person spent years getting different mental health diagnoses. First, your doctor might say they have ADHD, then social anxiety, maybe depression, or even bipolar disorder. They try many medications and they go to therapy for years, but something still feels wrong. Then they learn that they're autistic. They always were. And this story happens to thousands of people. Here's a fact that should worry every doctor. 3 out of 4 people with autism wait 8 years to get the right diagnosis. And that is after they see a mental health doctor. 8 years. That's almost 10 years of having the wrong map for your own brain. And for women, it's even worse. 1 out of 4 autistic adults get the wrong diagnosis first. For autistic women, it's 1 out of 3. Today, we're talking about a big hidden problem. It's when doctors don't see autism in people who have it. And we'll learn about ways this hurts people. The first way it hurts: lost time and not knowing who you are. Think about this. You spend years trying to fit into the wrong box. Doctors tell you you have ADHD, so you try to fix the ADHD problems. That makes sense. They tell you you have social anxiety, so you work on social anxiety. Here's the complex point, and that is sometimes ADHD symptoms do in fact hide autism symptoms. This makes it hard for doctors to notice and diagnose the autism. Regardless, here's what happens when you're autistic and don't know it. You start thinking you're broken in a way that cannot be fixed. Our first example: think about someone who has trouble with certain foods. Their entire life they've had trouble eating, certain types of food. For years, doctors thought this might have been an eating disorder, and they encouraged this person to get an eating disorder treatment. But what if it's actually autism? What if it's actually autism-related sensory issues? What if your brain just processes textures and taste differently? You see, once we understand this difference, the whole approach changes. The lost time isn't just about years. It's about missing help that could have worked a long time ago. The second way this hurts goes even deeper. It's medical trauma. It's not trusting doctors or the medical system anymore. You see, when people get the wrong diagnosis, bad things happen. They try treatments that don't work. They take medicines that have problems. They take medicines for problems they don't have. And they go to therapy designed for brains that work differently from theirs. Studies have shown that wrong diagnosis cause problems. People take longer to get help, and they have even more mental health problems. I see this a lot. Patients come to me after other doctors have said they were hard to treat or not trying hard enough. And these patients ultimately start believing they cannot be helped. For our second example, picture someone going through multiple antidepressant medications that don't help. They see different therapists, and each doctor say they are treatment resistant or difficult. But what if they were never depressed in the typical way? What if their struggles came from being autistic in a world not designed for autistic brains? You see, this is something a lot of people with autism struggle with. Imagine spending your entire life feeling different but not knowing why. You try really hard to fit in. You copy how other people act, and this makes you tired. When doctors say tiredness, they might call it anxiety or depression. But the real problem is you're exhausted from pretending to be someone you're not. Unfortunately, treatment might focus on the tiredness, not in helping you be yourself. But the truth is, you can't heal what you can't name, and you can't help what you don't understand. I've seen patients whose hard to treat depression got completely better. And this happened when they got autism-friendly therapy instead of regular therapy made for typical brains. So, what can we do about this big problem? First, we need better ways to test for autism. Some of the current tests were made by studying mostly white male children. We may be missing girls, women, people of color, and adults who learn to hide their autism symptoms, something known as masking. Second, doctors need to learn more. Every mental health doctor should know how autism looks in different people. Third, we need to listen to autistic people. They've been telling us for years about these problems. We need to listen and continue listening. Now, if this at all makes sense to you, here's what you can do. I have tagged some helpful links below to learn a bit more about this condition and how we can support each other. I also want you to share this video with 2 friends you care about. And if you can, tell me in the comments, what does this discussion bring to mind for you? Lastly, if you're a doctor watching this, thank you for all you do. Let's continue the hard work to create a medical system that works for all, including our most vulnerable patients. Once again, my name is Dr. J, and this has been Mental Wealth MD. Make sure to subscribe for more videos that help you understand mental health better. Oh, and remember, this video is just for learning. It doesn't replace talking to a doctor about your individual health. If you think you or someone you know might be autistic, please talk to a licensed medical provider to provide specific assessment and treatment. In the meantime, take care. I'll see you soon.